welcome to the second video of our A to Z series. Today's letter is B, which stands for better health outcomes. First, we want to understand why it's important that conditions and treatment, when understood properly by the patients, lead to better health outcomes. One reason for this would be early detection and intervention. Whenever patients understand their symptoms, that will help them know whether or not they need to go in to see their healthcare provider, and this will ensure more timely medical intervention to prevent worsening health conditions. Additionally, this may lead to improved adherence to treatment. When patients are knowledgeable about their treatments, it fosters an understanding and commitment to their prescribed therapies, which can enhance that treatment effectiveness. This can also lead to more informed decision-making. This greater awareness will empower individuals to make informed healthcare choices, aligning their treatments with personal preferences and needs, and ultimately allow patients to be more proactive in managing their health. We also want to take a look at the role that effective communication plays in achieving better health outcomes. Some examples of this would be, again, providing this clear understanding of conditions and treatments. Effective communication will ensure that healthcare providers explain medical conditions and treatment options in a way that the patient can understand, which then will make the patient more likely to grasp the information about their health and enable them to make more informed decisions and adhere to their treatment plans. This also will help build trust and collaboration. Good communication and an environment where the patient feels heard, respected, and understood will make them more likely to openly discuss their symptoms and concerns, as well as their preferences. This will allow healthcare providers to then tailor treatments to the individual needs of patients, which can promote better adherence to treatment plans as well as outcomes. Additionally, this empowerment through education allows patients to be involved in the decision-making process and be more informed about their own health. They can also, in this sense, have their concerns and misconceptions addressed. Again, whenever there's open communication between a patient and a healthcare provider, patients feel more comfortable voicing their concerns, asking questions, and clarifying misconceptions about their health. This dialogue will then enable healthcare providers to address fears and alleviate anxieties surrounding a certain healthcare condition. One example might be for a diabetic patient who will receive comprehensive education from their healthcare team about the importance of blood sugar monitoring, medication adherence, and dietary modifications. The outcome of this is with increased understanding and adherence to recommended lifestyle changes and a medication regimen, the patient will then achieve a better blood glucose level, which can lead to reduced risk of complications later on and overall improved quality of life. Another example might be for a child who experiences asthma attacks. Parents sit through some educational sessions with a healthcare provider where they learn about triggers, proper inhaler techniques, and any early symptoms of an oncoming asthma attack. The outcome of this is the family can then gain confidence in managing asthma effectively at home. The child will then possibly experience fewer exacerbations, fewer emergency room visits because they know what to look out for, and ultimately be able to lead a more active and symptom-free life. One final and third example of this might be for a cancer patient undergoing chemotherapy who participates in educational sessions with oncology nurses, where they can learn about the treatment process, potential side effects, symptom management strategies, and the importance of follow-up care. The outcome of this is that the patient will feel empowered and knowledgeable about their treatment journey. They are more likely to adhere closely to the treatment plan and report their symptoms properly, which can result in fewer treatment interruptions and potentially improved long-term survival outcomes for that patient. Overall, these are just a few examples of how improved information can lead to better health outcomes for patients. Join us next week for video C in the series, which stands for Clarity in Healthcare Communication. Thank you.